Hello and welcome to The Virus. I'm Jeremy Fernandez. The end of COVID isolation mandates in Australia is being described as D-Day by the peak body for doctors in Australia. Every time there's been an easing of restrictions, we've seen a surge in cases. If you now test positive, you're no longer required to isolate, and masks are no longer mandatory. In New South Wales and Victoria, reporting a positive RAT test is now optional. In this extended version of the show, we're looking back at the outbreak and the likelihood that it was more likely transmitted from animals to humans than from a Chinese laboratory. We've all been through a lot in the 3 years since the disease was first detected, from closed borders to social distancing and lockdowns, the rush for tests and face masks and vaccines, plus schooling and working from home, to now opening up to an extent we've not seen since early 2020. And that's not to mention the staggering death toll and looming impact of new variants and long COVID. So what have we learnt? And is the worst behind us? In many ways, COVID can be best understood through the numbers. Our data analyst Casey Briggs is with us. Casey, that big screen behind you has been a big help in understanding this pandemic, hasn't it?
Yeah, it's been useful, Jeremy, because, from the beginning, March 2020 and even in the weeks before that, this has been all about tracking and poring over those numbers to understand how this pandemic has evolved. And if I show you, let's look at Australia's case curve right back through to mid-2020, and it tells you really clearly that Australia has had two eras, two different strategies for managing this pandemic. The suppression era, let's call it, the era of lockdowns, the era before we had vaccination, where very little virus was tolerated, and then once the vast majority of us have been vaccinated, an era in which that has all changed, in which we have permitted the virus to circulate among us in this country. And it's really quite stark, isn't it, Jeremy? You look at this now, the dark days of Delta in 2021 are barely visible on our case curve now because of just how much virus came through when Omicron started circulating. Let's just zoom in on 2022 though as well, a year where we've seen now 4 waves of this virus. So far, at least, there are still a couple of months left, and now case numbers tailing off. Jeremy, I just need to explain, we've made some changes to the way we present these charts now, because we don't have daily figures anymore, we have weekly figures. So this is showing us the number of cases reported in each week, including back for that previous year, and we had daily figures. That's why we've got a 500,000 at the start of the year. That's over an entire week, not a single day. And we're seeing that now tailing off. This week, 35,000 cases reported around the country. And we do, I can hear thousands of people at home now yelling at me, well, we don't know how many cases there actually are because no one's getting tested anymore. And yes, that is true to some extent. But we do think this curve is trailing off at the moment, not just because these numbers are going down, but because hospitalisations are going down, because positive readings from wastewater and sewage testing is going down, and also because the numbers of deaths are going down and going down actually relatively quickly at the moment. 121 of those were reported in the past week. Still a lot, but a lot fewer than what we were seeing part way through this year.
And of course, lots of people are living life like it was back in 2019, mainly because they've been able to get vaccinated. But globally, there are some significant vaccine black spots, aren't there?
Yeah, we're in a pretty privileged position in Australia, Jeremy, where, the vast majority of us are vaccinated with at least a couple of doses. But when you look around the world, there are black spots, and you can see it on wealth lines. Let's just look at a couple of examples. These are the highest income countries in the world vaccination rates with the first sort of initial course of vaccinations, versus the lowest income countries. The highest income countries first. About 3/4 of people in those countries have had at least their first doses of vaccinations, and it's been that high virtually all year. It was at 70% at the beginning of this year. Meanwhile, some of the poorest countries in the world have been low and have been climbing their way up slowly, but still a really, quite frankly, poor vaccination rate, 18.8%. So less than 1 in 5 people in the world's poorest countries have had even their initial doses of vaccines, let alone getting boosters. And if I show you them on a map, you can see where that issue really is most concentrated. Really good vaccination rates across Europe, across North, South America, and of course in Australia. It's Africa where you see some frankly, very low vaccination rates. You know, countries like Congo, 11.9% vaccinated, Niger, 14.8%, Sudan, 14.6%, Algeria, 17.8%. You know, these are the kinds of numbers that are typical, and there are some that are even lower in terms of access to vaccinations and uptake in vaccinations. And one other country I'll show you as well is very close to home for us, Jeremy. It's Papua New Guinea. Just 3.5% of people have been vaccinated against COVID-19 there. And there the issue is actually less about getting doses to PNG. They've had doses expire and have donated doses to other countries because they haven't been able to use them because of vaccine apathy, a bit of hesitancy, and just sort of, you know, a reluctance in that country for people to take it up. So that is a real challenge. It is leaving people in some of the world's poorest countries vulnerable to this disease still, as we in the wealthy world appear to have moved on.
Casey Briggs, thank you. So what does the future of the pandemic look like now that almost all the restrictions have gone away? To discuss this and the lessons of the pandemic, I'm joined by epidemiologist Professor Nancy Baxter, GP Dr Mukesh Haikwal and the ABC's medical reporter Sophie Scott. Welcome to all of you. Professor Baxter, I'll start with you. The pandemic isn't over, but there is a real sense that most people, most governments have moved on in some way. How would you describe this phase of the pandemic that we're in?
Well, from a definition perspective, the pandemic is not over. It still meets the technical definition of a pandemic in terms of, you know, infectious disease that's rapidly spreading across continents. But I think from a psychological, social, and political perspective, the pandemic is very much over. In that politicians, governments, people don't really seem to be willing to change behaviors or put in much of an effort to try and avoid getting COVID or transmitting COVID.
Dr Haikwal, what are the best lessons we need to take out of this past 2.5 years?
I think the lessons from way back in 2020 need not be forgotten. In other words, this isn't over. It needn't be as cruel a lockdown as we've had before. The lesson we've learned is that we can do good things to avoid spread of this disease. And let's not forget some of those lessons, which includes when you're in confined places, masking up. When you're, having ventilation, use more wisely, including filters, and making sure that when you're ill, you stay at home, whatever the illness. Yes, COVID, but other illnesses as well. And that, to me, is the lesson that hasn't really been learned, as people are now back on buses, back on the streets, and back in crowded areas, coughing and spluttering everywhere, which I'd have hoped is the main theme we'd have learnt from what we've been through.
Who is the onus on to make sure that those measures are upheld in some form so we keep ourselves safe?
Well, I think everyone's gone to ground on that one. I mean, as Nancy said, that no one's making any real effort about giving any decent steer to the populace by state or nationally. And so people have been just said, well, fend for yourself. And, you know, that's certainly, you know, a reasonable thing to hope for. But sometimes it needs some good messaging. If you're not going to do any actual strict rules and laws, then you've got to give very straight, clear messaging. And I think that's actually become even more confused with the recent coming down of the current pandemic parameters stopping in Victoria a couple of days ago and the rest of the country yesterday.
Sophie, this week an international task force reiterated that COVID most likely jumped from animals to humans. What did it say about how prepared we are to prevent this sort of transmission happening again in the future?
Well, Jeremy, it really said we need to be doing a lot more. We need to be doing a lot better. It suggested that we need to be introducing what they call smart surveillance. So really targeting places where you have risky interactions between animals and humans. So that's things like wet markets. And making sure that you're doing testing of not only the animals but the humans that work there as well, to see and make sure that you're picking things up early rather than waiting until something takes hold like COVID did, and asking people who present to a doctor with unusual symptoms that they haven't seen before, have you been in close contact with animals? You know, making that a routine part of a diagnostic or a history that a doctor would take. You know, they're not talking about universal screening, but just saying, you know, the lessons, we need to learn the lessons from what we've been through the last few years. And what they're saying is that at the moment, not enough's being done to stop this happening again. And I would just add to what the other panelists were saying before about what we've learned. I think what we've learned is that just how important public health communication really is, and how damaging it can be when it's poor, when it's not given out in a multiple of languages so people can understand it and take it on board. And as far as we can see, that the public messaging has really all but disappeared. So the public out there, it's for them, it's very confusing. As someone trying to report still and find out information, we used to get fantastic information about case numbers and data, and that's how you can make informed decisions. Now it's extremely difficult to get that information. It's not given out proactively very often. The Chief Health Officer in Victoria does put out some data, which is interesting, but other than that, it's very difficult to get.
Professor Baxter, we keep hearing about the importance of vaccination, but if more than a third of the world's population is unvaccinated, what does that mean for the rest of us?
Well, I think it's a tragedy that our miscommunication about vaccines was able to get around the world before vaccines were able to get around the world. And just to Sophie's point, I think communication, what we've really, one of the key things we've learned from the pandemic is how important communication is and how much more proactive we in the public health community need to be to counter what is a very organized and in some respects, purposefully deceptful approach to communicating about the pandemic and about vaccinations. But in terms of the vaccines, what we really need to use the vaccines for at this point in time with the current vaccines we have is to try to manage the serious disease related to COVID, so the deaths and hospitalizations. It's not going to be the way we manage transmission because the vaccines are only effective against transmission for a relatively short period of time. They have some effect, but not a perfect effect. So that 30% have not been vaccinated doesn't really stop the fact that there's going to be this ongoing transmission of COVID. It's just a tragedy because being able to vaccinate those groups of people would be able to decrease the burden of disease in those countries. And a lot of that isn't about supply of vaccine. It's actually people not wanting the vaccine.
Dr. Heikewal, just quickly with you, as you know, there is a surge taking place right now in Europe and the United States. How indicative is that of what we are likely to face this summer or next winter?
Look, the actual stats will be with Nancy, but what we've seen is a peak starting to happen again in Europe. We also had problems around this time last year. We had cases in October, November going up to 2,000, and we were told that wasn't going to be a problem. Of course, in January, February, it went up to 50,000 a day. I think that we need to be wary. I think we need to have the capacity to learn that the message is, if you do get sick, stay at home. Please get tested if that happens. It'll be more difficult to get a test, of course, because some of the testing centres like our own have actually stopped testing now. And to make sure that if you were not vaccinated, and there's a large number of people who haven't got that third dose yet, please get the third dose and the fourth dose when you're eligible for it soon after that.
Dr. Mukesh Heikewal, Professor Nancy Baxter, Sophie Scott, thank you all. Well, we've heard from the health experts about what lies ahead, but how do you feel about this next phase of eased restrictions?
A bit nervous, I think.
I'm worrying, like many people would, that we might have moved too fast, too early.
I think it's been a while since we've had some good freedom in the country and just in the city. It's nice just to move on from that stage.
I feel fine as long as people are vaccinated and have masks.
Mixed feelings, because I actually think it's important that we track how this type of disease is progressing, because we don't know where it's going to go next.
I worry about people who are immunocompromised and stuff.
I'd like to see maybe mandatory mask wearing continue at least for another 6 months until we see how the land lies and where we are.
We've all felt a range of emotions over the course of the pandemic so far, from anxiety to apathy and optimism. We've been on quite the journey in public health messaging, which has gradually subsided as restrictions have eased. Professor Julie Leask is a social scientist specialising in immunisation. She joins us now. Professor Leask, we've all had this roller coaster of what to do during the pandemic. Now that the public messaging has died down, where does that leave us?
We still need public messaging. There are still some important things that we need to continue to do to have our boosters, to have an antiviral plan if we're eligible, and also to make sure we stay home when we're sick. Even though some of those requirements are no longer with us, there's still some things that remain important. And so we need to keep hearing that from our health leaders to make sure that we're very clear about what continues to be important in managing this disease.
Is there a bit of conflict there, given that restrictions are easing and all the way up to the WHO, there's this sense that the end of the pandemic is right around the corner?
That's right. Just because we even face the end of a pandemic, it doesn't mean that COVID has gone away. And it will continue to pose a risk for people, particularly older people and others who are at risk of severe disease, such as people with chronic illness. And so that's why our leaders need to keep our attention in terms of saying, we recognise what's come before us, we recognise that things have changed, that sometimes the messages feel inconsistent because the science has continued to evolve and our situation is changing. But we want you to keep paying attention to these key behaviours that prevent and manage COVID risk.
Trust has been such an important factor over the last 2.5 years. What have we learned about the way fatigue and messaging and trust work in these circumstances?
Trust is central to the way we manage any pandemic and any infectious disease emergency, because if you have the public trust, you have that cooperation that's so central to what we need to do to manage risk. And everything we do needs to centre on retaining trust. Trust is promoted through acknowledging what people's experiences are, understanding the diverse experiences that people have and their perspectives. It's fostered through empathy, it's fostered through technical competence and consistency, which of course has been a challenge. And we need to continue to retain that trust by being honest, frank and open with people, particularly when there are policy changes that occur, to understand what sort of trade-offs were considered, what dilemmas were considered, why have you done that, and what do we still need to do in order to manage our risk of COVID.
Professor, it's great to have you on the show. Thank you.
Thank you.
The quick development of COVID vaccines has been one of the successes of the pandemic. Associate Professor Nicholas Wood is an immunisation specialist. He joins us now. Professor, thanks for being here with us.
Thanks very much for having me, Jeremy.
The pace of vaccine development really has been history-making. To what degree can we rely on that pace continuing, given that the variants are continuing to spin off?
Yeah, so the pace has certainly been fast, as you said, and however, it did not mean that any corners were cut. So usually it's a long process to get vaccines through to preclinical development, through the trials, through the authorization, and then out into the community. And because of the pandemic, what that meant that there was a lot of money thrown at it and a lot of people involved in getting the vaccines through all those different stages. So just for example, normally to recruit 30,000 people onto a vaccine trial would take many, many months. But because of the pandemic, the companies like Pfizer and Moderna and AstraZeneca were able to recruit onto those vaccine trials in a matter of weeks. So some of the things happened very fast.
Has there been pressure on those checks and balances given the need to roll this out quickly?
Yeah, I think there definitely has been pressure, but the regulators have stepped up. So I don't think they've said to the companies, you only need to supply us half of a dossier. We still expect the full clinical dossier, the full clinical trial information, and without that, we're not going to review it. So the companies, probably employed more people to, get the dossier together quickly. And the regulators also, because of the pressure to get the vaccines out because of the pandemic, have had more people looking at the dossier as well. So there was just more people involved, a lot more hours spent by those people, over and above the traditional sort of Monday to Friday working hours.
How much can we lean on vaccines to keep up with the variants?
Yeah, that's a great question, and I'm not sure that we really know the answer yet. I think it's a little bit like we're chasing our tail at the moment. So the virus is ahead. New variants come along, and then we might try and tweak the vaccine to cover that variant, but then the virus jumps ahead again with a new variant. So we are a little bit chasing our tail. I think what we have learned with the Omicron variant is that so far it is more infectious and transmits more, but is a little bit less likely to be severe, particularly in children. And so, ultimately, it might just go the way of the sort of common cold coronaviruses, for which, we have had for many years, and then sort of, become less of a concern. But time will tell on that. So, yes, so chasing the variants is a hard thing to do, particularly as the virus is sort of, driving that and it's ahead of us.
Is that likely to be a global trend? Because we know there have been issues with equity of access across different countries, right?
Yeah, absolutely. So we really, in an ideal world, we would have the whole world vaccinated. That would mean that we would probably, reduce the amount of disease, amount of deaths, and possibly then less variants around. I'm not sure that we've been able to achieve that. In fact, we haven't been able to achieve the whole world being vaccinated. So that means that the virus is still circulating in some parts of the world. And each time a virus replicates, it has a chance to mutate, and that's how new variants get created.
Professor Wood, thanks so much for being with us.
Thanks very much.
Bill Birtles is the ABC's East Asia correspondent. He reported from the centre of the outbreak in Wuhan at the very start of the pandemic. And reporter Stephanie Ferrier is in Melbourne, which experienced the world's longest lockdown. Welcome to you both. Bill, China is continuing to pursue this COVID zero policy. How sustainable is that?
Well, Jez, it depends who you ask. We've just seen indications in recent days that ahead of this major Congress, which is being seen as a possible reset of Chinese government policy that's coming up next week, there have been a lot of expectations that the COVID zero policy might change, but we've seen in the last couple of days some pretty strong statements from the Chinese government that it is going to stay in place. Now, the language from the Chinese government basically indicates that it is sustainable for a long period of time, and the zero policy in the eyes of Chinese authorities is the best low-cost option to try and keep the population safe and to keep the economy going. So that sort of language suggests that we're probably looking at years, but there is a tremendous amount of frustration in China about this policy. In some cities, people have to get tested every 3 days. We're not talking about rats, we're talking about PCR tests. And so there's a great deal of debate, even though it's not public debate, I think, within China about how sustainable it really is.
Stephanie, there's no mistake that successive lockdowns were gruelling for Melburnians. Has it changed the city and the way people think about this phase of the pandemic and the future?
Yes, Jeremy, I certainly think that it really has, because we have seen so many different responses that I've heard from people across Melbourne and Victoria while reporting on this for the past couple of years. And it's fair to say that it wasn't just a story that I was covering, but I was also living through it at the same time, reporting on the day-to-day events, then coming home to the horrors of home learning and a frustrated husband trying to work from home at the same time, and hearing about family and friends who had lost their jobs, as well as other people who had got quite sick from COVID-19. So I think it definitely has really changed the mood of Melbourne. What we did see was more than 260 days cumulatively in lockdown, and by the end of that, I think people's nerves were pretty frayed, and I think it's fair to say that most Melburnians feel pretty triggered when they hear some of those phrases we might have heard, hanging on what time is Dan for the Daniel Andrews press conferences to find out what was going to change in our lives, the ref rate or the rolling averages, for example. In terms of the future, I think that the government here would really prefer that Victorians look forward rather than back at those dark days, because we do have a state election coming up in late November. And of course, we have no pandemic declaration anymore. That fell away on Thursday. However, there is a real sense of resilience here in Victoria. And one of my friends, when I asked her what she thinks about the future, she said, I simply think that people are much more now adaptable to change.
Stephanie and Bill, thank you both. One of the greatest mysteries about COVID is the syndrome known as long COVID. It affects roughly 1 in 10 people and is generally defined as the persistence of symptoms for more than 2 months after infection. Patients can have any one of more than 200 symptoms, which makes it tricky to treat when they might have other health conditions too. Professor Gail Matthews is the head of infectious diseases at St Vincent's Hospital in Sydney and is one of the lead investigators of Australia's first long COVID study. Professor, welcome to the program.
Thank you for having me.
How well understood is long COVID today?
Well, I think it's better understood than it was, a couple of years ago, and certainly better recognised. And I think that's very important. But we are still a long way away from understanding so much about long COVID. Even how common it is really is still unknown. Depends very much on how you define it and what exactly causes it and how to treat it. I mean, there are many things we still don't know, but we know a lot more than we did.
How serious is the condition?
Well, it can range from being something that is, people are symptomatic from but can live quite normal lives, to people who are extremely debilitated and unable to work and enjoy their life as they should be able to do. So it can be incredibly serious from a patient perspective.
When you're dealing with such a wide spectrum, how easy is it to treat? And are we far off a cure?
Yes, I think we're a way off a cure because to find a cure, we would have to really understand exactly what long COVID is. And it's very likely that long COVID is in fact several different syndromes, and all of those different syndromes or pathogenesis, if you like, are going to need a different approach. So at the moment, unfortunately, there are no specific therapies for long COVID. There are certainly drugs that are being studied and in large studies, particularly in the UK and the US, there are combinations of drugs that we use quite often for other things, but we're a way off getting an answer as to what's really helpful for patients. So really, at the moment, therapy for patients is really around excluding other significant problems that need treating, and also management of symptoms, and that can be quite complex depending on what the symptoms are.
We know there's a fair bit of anxiety for people with long COVID. What do you tell them the prognosis is of getting back to normal life?
Well, I think we have to firstly acknowledge that we don't have the answers. I think we have to acknowledge that people have symptoms. And so just a sort of recognition and a validation, I think, firstly of what people are experiencing is important. But we can say that most people do have some improvement, particularly if they're well supported, by their general practitioner, but also any clinics that they may be able to access. Physiotherapists, very important. Psychologists, very important. There's a whole range of services. So I think if patients can access those kind of supports, they will certainly see improvement in their well-being and an ability to sort of live a normal life as far as possible.
Professor Gail Matthews, thank you.
Thank you.
Before we go, let's bring in Dr. Norman Swan for his final thoughts. Norman, you've been with us since the very beginning of the show in March of 2020. Is the worst behind us?
We've got no way of knowing. This is a very unusual virus. It's not behaving the way people expected. The worst might be behind us, or it might not. I'm sorry not to be able to be definite about it. 13,000 people have died in the first 6 months of this year, and that could happen again with the next surge. We just simply don't know. People have got to get immunised. They've got to keep their jabs up to date, and that's the best protection we have at the moment, as well as ventilation and masks. And hopefully next year sometime there might be a better vaccine available, which will break the cycle. But at the moment, we've just got to wait and see.
Norman Swan, thank you.
Thanks, Jeremy. It's been a pleasure to be on the show.
And that is the virus for now. It's been 2.5 years since we set this show up as a place for reliable analysis of the biggest health crisis in generations. And we've chronicled history along the way too. Thanks to the experts who've given us their time and expertise throughout. And thank you for watching, writing into us and engaging with us on social media. It really has been a pleasure. The virus team, Michael, Emily and I, will be keeping a close eye on things for the ABC News channel as we move into this new phase of the pandemic. Thanks for watching. Bye for now.